Yes, a question that flows from two events that we saw recently that we wouldn't have seen at previous White Houses. The first was the campaign meeting in the Cabinet Room last month, and then the political speech in the Rose Garden this week. Can you talk about your understanding of what the White House policy is for this White House as far as politics? Is there any place in the White House where you think politics is inappropriate? I mean, where do you draw the line?
We act in accordance with the Hatch Act. It's well established that the president and vice president are not subject to the Hatch Act. It says this much in the Hatch Act. It says that the Hatch Act applies to executive branch employees, which is defined in the Hatch Act as employee, meaning any individual other than the president and the vice president. So his speech in the Rose Garden was entirely appropriate.
The Hatch Act has nothing to do with this, though.
What? It has everything to do with this. Go read the Hatch Act. That's what you're alleging is problematic for the president.
Stating
but your real problem was the fact that the president gave a very good, powerful speech from the Rose Garden. Owen.
Well, you talked about earlier with school districts, but we're seeing more school districts, at least in Virginia, for example, last night, deciding to go online only. What does the president say to parents out there who are now going, okay, what do I do with my kids?
Yeah, the president has said unmistakably that he wants schools to open, and I was just in the Oval talking to him about that. And when he says open, he means open and full, kids being able to attend each and every day at their school. The science should not stand in the way of this. And as Dr. Scott Atlas said, I thought this was a good quote. Of course we can do it. Everyone else in the Western world, our peer nations, are doing it. We are the outlier here. The science is very clear on this. That, you know, for instance, you look at the JAMA pediatric study of 46 pediatric hospitals in North America that said the risk of critical illness from COVID is far less for children than that of seasonal flu. The science is on our side here, and we encourage for localities and states to just simply follow the science, open our schools. It's very damaging to our children. There's a lack of reporting of abuse. There's mental depressions that are not addressed, suicidal ideations that are not addressed when students are not in school. Our schools are extremely important. They're essential, and they must reopen. Yes.
Thanks, Kayleigh. The U.S., Canada, and the U.K. today accused Russia of trying to hack coronavirus research, vaccine research. I was wondering if the president has a response to Russia to that.
Yes, so the one thing I would say about that, and it was announced earlier today, is that we worked very closely with our allies to ensure that we would take measures to keep that information safe, and we continue to do so, and we're aware of those activities. Yes, Janelle.
Thanks, Kayleigh. On the CDC, on the movement of data going straight from CDC to HHS now, understanding that HHS needs access to real-time data, was there also any concern whatsoever undergirding this decision regarding CDC's possible manipulation of data? There were some reports coming out of Florida. Certain states were coming out and saying mid-level CDC reports were not necessarily accurate. And so did that have any effect in this decision to send data straight to HHS?
No, the intent for this decision, and I talked extensively today with Dr. Birx, with Secretary Azar, and with Dr. Redfield about this. The intent of this is we need to make sure that there is daily data that is being given to Dr. Birx and others who are running point on a lot of our actions with remdesivir and identifying hotspots. And I would point out, and I just want to explain this because I think there's been some confusion in the press, that there are two methods of data collection. The one is the National Healthcare Safety Network, and this is a CDC system, and this is where hospitals voluntarily report their data, and about 81% of hospitals were reporting their data. So we don't need 81% of hospitals reporting data. We need 100% of hospitals reporting data because it is critical that Dr. Birx and others receive the daily admissions, ICU use, and PPE numbers, and when you're only getting 81% of hospital data, that means you've got 19% of hospitals that were unaware of their needs. So what happened is we also have a second method of tracking this data, and it's the TeleTracker database, and this is an HHS system. And this was initially used for purposes of provider relief funding, and we asked hospitals to tell us about their COVID admissions so that we could identify possible hotspots. And as it turns out, this data ended up being more complete, more up to date with information. And so ensuring that hospitals are reporting into this system where we're getting more complete data was the reason that HHS has had this transition where they've asked hospitals to transition reporting to the teletracker system. It's important, especially with remdesivir distribution, that we know exactly where the needs are so we can surge them. So this...
Still have access to this data.
Yes, that's right. So I did confirm that with Dr. Redfield, that this is completely open source data available to the CDC. Secretary Azar says we insist that they use it, and no one, and Dr. Redfield confirmed this, no one is taking access or data away from the CDC, and that data is routinely published so that the American people are fully informed.